So you can see, thanks so much again for everyone joining us. If you are just popping in now, our agenda for today for this community conversation, we're trying to focus on sharing some updates from the FRC, and in particular, how you can connect with us if you have a family that you want to refer to the FRC. And then also one thing that's really new and exciting for us, some of you have heard this and some may not have, but we do have a new permanent site in the rural area. So we're going to talk a little bit about our new location out in Hawley. And then later in the meeting, Kaylin is going to join us, who's our Family Advisory Board Coordinator. She is working to recruit new members for that board. So she'd like to have a little time at the end here to touch base on what's coming up for them and what needs they have as far as new folks joining that advisory board. A couple other just little housekeeping things. If you have anything you would like us to share out as we share out this recording, please let me know. After this meeting, even you can share it to me and I can put together a list of resources that people should be aware of so that they can see what's coming up. And then also next month, we have a couple different meetings we'll be hosting. So we won't be hosting this second Friday community conversation, but instead we'll be having some meetings regarding our microgrant process for partners. And we'll also be doing some of that recruitment for that Family Advisory Board group next month as well. But keep an eye out for upcoming meetings and invites in the future. And let's see here. I'm going to switch my view. It's just so hard because I can't see your faces when I'm sharing, so I don't know how much I like that, but I'm going to see if I can see your faces a little bit more. Otherwise, I think we're going to get started here. Oh, hi. Go ahead.
Hi.
Sorry, I can't see you either, but I like to see you all. Okay, so I'm going to go ahead and get started. I'm just going to do a little brief overview of the Family Resource Center model, and then I'm going to turn it over to Jill so she can talk to you more about Resourceful and how we've been investing in using that as a referral source. So we'll get going there. So I'm going to flip back to those slides. Do you see on these slides all of our notes too, or just the slide? I'm sorry, Steph, would you let me know if we see just the slide here, or do you see some extra stuff?
Just a slide for me.
I love that. Oh my gosh, now I can see all of you and just the slide, and so this is the best ever. I love this. Okay, thank you for your patience with me. So let's move on then. A little bit about Family Resource Center. We're not going to spend a whole lot of time talking about our model, but for those of you who might be new to the model, or just to do a little bit of a reminder about what we're all about, this pyramid is a great visual for where the Family Resource Center lies in all of those different family strengthening programs that are in Clay County. So our goal is to be one of the most broad resources that's available to families. We don't have any eligibility requirements. We can connect with any family who has a child under 18 in their household. So that's kind of our one criteria, as we are looking at families in terms of those who are currently caregiving for youth. And also they have to live in our Clay County area, but they could be a group of people living in a household who are related in any sort of way, and we of course support all families. So one of the things that we want to highlight is that we are quite broad, and being very broad in that way, we are focused on outreach. We're trying to find those families who don't quite know what services are available to them, who are maybe just coming into a new problem in their life and they're not sure who to turn to, who could help them with that problem. And we're trying to help those families navigate. And so we're talking about navigating, we're looking at how can we help them find resources that can support their family, and also how can we help them connect to those resources. So would it be helpful for us to do a call with them? Do they need transportation to actually use the resources that are available? Is there another gap like childcare that's been interfering with their ability to access resources that are already available to them? We are really focused on prevention. So we are working with some protective factors, trying to enhance those for families, and we'll talk about that on the next slide as well. We are looking to connect folks to resources that do exist now. And so sometimes what's coming up is we'll see that there are gaps in resources. Like we don't know what are the resources, or we are looking for a resource that just doesn't exist at all. And so sometimes we're doing some systemic work there to try to say, how can we get a new resource established in this community that actually hasn't been there in the past? And we really appreciate that opportunity to do that type of work. And we also know it takes a long time, as all of you do who've been working in the community for a while know that filling those gaps systemically can be a long process, but we're also part of that kind of work. Um, we are hoping to help families connect to one another so that one of the resources they can rely on is each other. So we're doing some educational work, some social programming. Sometimes we're running those programs ourselves, and sometimes we're relying on partners who are running the programs already, and we're uplifting the work they're doing or try to enhance the capacity of the work that they're doing in some way. So that's a little bit about what we do. As you can see there in the bottom rung, it also says that we're trying to provide this network of providers for stronger referrals. So we want to make sure folks are collaborating, that we're not duplicating the work that other people are doing, and that we can make really good, strong, seamless referrals to the resources that are available. A lot of you in this meeting are actually, you are in this sort of blue colored area. You're a little bit more intensively working with families than we might be. And that's not true for every group who's joined today, but there are a number of folks who are partnered with us who do case management. They work day to day with families, supporting them over a long period of time. And that isn't something that the FRC is doing at this point. We don't do any case management and we don't have any long-term support for families. Our goal really is to be that readily available resource to connect somebody quickly when they first start to notice there's a problem, or maybe they just need some extra support because we know parenting is stressful, caregiving is stressful for all families. So we want to be that support there. With referral in mind, then we also want to make sure that we know how to refer to you. And so that's a large goal of ours as well, is to keep connecting with your organizations and make sure that we know what are the best ways to refer families over to you, what are the resources that you're providing, how can we best connect families to the work that you're already doing. And then we want to help to enhance that work that you're doing at this level. So we're probably not going to be a family's primary contact if they're in this case management kind of level. You probably will be their primary contact, but we don't want to then just not support the work that you're doing with that family. So we're happy to enhance the work you're doing with providing, whether it's helping you outreach to families, whether it's helping you with some concrete supports for families to meet their needs. We're very happy to help with that type of work too. What we're finding though is that sometimes, since you're that primary support for the family, it's best for us to connect directly with you to find out, what does this family need? How can we actually be the best support? And how can we make working with the family easy as possible on the family, so they don't have to come to us and ask for support directly to somebody new they haven't met before. We don't have to maybe ask them for an intake process, only to say, oh, yep, we just have this small support, and then you'll go back to your case management or your other more steady contact that you have. So that's one of the things that we've been working on in this referral process, is to figure out how we can maybe enhance the work that those in this blue level of the pyramid are doing, without making families feel like they're getting the runaround, like they're having to explain their story to a bunch of different people and then maybe not end up getting the resource that they hope to get. One other thing I want to highlight as we're still looking here on this slide is about families in crisis. We really aren't set up for crisis support, and that's why we're partnered with a number of amazing agencies. Solera is one, FirstLink is one, who are open 24/7. So if you are encountering families who have that high level of immediate need, those are still your traditional resources to go to, and we would rely on them as well. So if a family in crisis was referred to us, we will just sit with that family and we'll call those traditional resources that have existed for quite a while. So that's one other thing I wanted to just highlight there. And then as we look at how we're being preventative in our work, we have these 5 protective factors. I know those of you who've been to these meetings and trainings before, you've heard about these. Some of you are well versed in these and know all about them, but just for others who might be newer to FRC, what we're focusing on is putting these protective factors in place for families and trying to be kind of strength focused in our work rather than thinking only about what a family might be in need of. We're thinking about how can we enhance those strengths they already have and put some more strengths into place. So we are looking at things like caregiver resilience. Can we help families to enter training programs, to get education, to get support when things are stressful, you know, that they have lined up ready to go. We're also looking at those social connections like we talked about before. So if your organization has social events that you want us to highlight, that you want us to share out to the families that we see, we're happy to do that. We know that there's a lot going on in the community and just sometimes people don't always know about it, or maybe they can't get there. They don't have transportation to those events that they want to attend or those opportunities. So those are really great chances for us to help families by connecting them to the rest of the people in their community. We do have some concrete support for caregivers. So this means when someone has an immediate need, we're trying to fill that need. And that could be through helping them get signed up for a benefits program. That could be that they need a gas card, they need a bus pass, they need some groceries this weekend, they need diapers right now for their kiddos. Those are all things that we are able to support families on, keeping in mind that we are still at that preventative level. So primarily we would not have any ongoing support for families in any of those needs. So if a family needs diapers this week, we can probably get those diapers to them pretty quickly. If they need help getting diapers every week for the rest of the year, that would be something that we probably wouldn't be able to support. So those are some of the kind of things to keep in mind, I guess, as we send families this way. And then the next one is caregiver knowledge of child development and parenting skills. And it kind of goes in combination with the social and emotional competence of children. So we are trying to work to provide trainings for families, to provide opportunities for them to learn more skills, to talk with other families, to support their children and their mental health as well. And so often we're partnering with other agencies to do that type of work too. So that's a little bit about how we do the work we do. And if we move on here to the next slide, I want to highlight our core team. We'll talk more about the structure of our program as we continue through this presentation. But we have a core team. We can have about 15 organizations as members of this group. They meet once a month and they help us to make decisions about strategic direction, policy for the FRC, and we really are trying to collaborate with these other agencies to make sure we're supporting families in the most seamless way possible. So most of the icons of the different core team members are listed there. We have some newer folks who've joined us that maybe you don't see highlighted. And so I'll call a couple of those out. One is Clay County Restorative Justice. They have been a huge part of our program for the core team, and they are underneath Clay County, so they don't have their own little logo there. I'm gonna pop this off here. I think it stopped sharing. Sorry about that. I think someone's popped up. Do you still see the slide stuff? Can you give me a thumbs up? From my view, it looks like they're gone. Oh, you do. Okay, perfect. Thank you. I apologize for my jumping around here then. So the core team, we are about full on this group. We are looking to add maybe one more rural member to this team. But other than that, I think we have a pretty great team and we'll keep working in that way. And then next one, we wanted to spend a little bit of time just talking about how to refer families and what to keep in mind as you might send a family our way. So again, just to remember that our work is to connect families to existing community resources and to one another. So if we know that a resource maybe doesn't exist in this community, for example, we've been talking a lot about how hard it is for families who have to get their kids to childcare, and then they have to take a bus to work, then they have to get the bus back to childcare and get their kids home from childcare. That's a really intense and difficult situations for families when they have to take the public transportation system. I think we are aware of that as agencies, and so if you're encountering a family who has that kind of difficulty, it would likely be best for us to visit together as partners to say, what can we do right now to help this family and how can we help them longer term? Where if you send the family directly to us and we start visiting with them about their need, I think we're going to come to the same conclusion that you may have, is that we don't really have a support that will take families to child care, help them take their kids to childcare, get them to work and back and so forth. So we want to just keep in mind that while we're working to fill gaps and to create some of those bigger picture changes, we still are working with those existing community resources, and we don't want families to ask multiple places for the same thing and keep hearing no answer. Another reminder, we talked about this already, is that we're providing those limited short-term supports for immediate needs in terms of any concrete supports we're providing. And then our goal is to make it as easy as possible for families to get the help they need. So sometimes it's best if we connect directly with the family, and other times it might be best if we get you the bus pass and you deliver it to the family that's in need, because you have that close relationship with them and you're one of our partner organizations. So that's one of the things we want to work on with this newer referral process. We talked about already that we are prevention focused, and our crisis support services will remain those traditional services we've used in the community already. And then lastly, that we are still partnering with organizations to try to reduce those larger gaps. Okay, so I think, Jill, I am going to try to turn it over to you to share. I'm going to stop my sharing and figure out my screen a little bit better here. Jill is going to fill us in on our use of Resourceful, or sometimes called Find Help, and show you a little bit about how that works, and then we'll wrap up with a bit more about our end after you've referred a family through Resourceful.
Thanks, Angie. Can you see the home screen of Resourceful for me?
Yes, I can. Thank you.
Perfect. All right. Well, we'll just jump right in. And I guess maybe it would be helpful, hopefully, if I switch over to PowerPoint here, you can see it.
Yes, I can see that one, Jill. Thank you.
Perfect. Okay. So I know in Angie's email in talking about their transition of accepting referrals at CAP LP, now using Find Help as a way to do that. I think it might be helpful to just start by helping folks understand what is Find Help, what is Resourceful, and what's the difference. So I just want to clarify that Find Help is sort of the house. It's the platform that we're using to connect people to free and reduced cost services utilizing a closed loop referral system. Now, Essentia Health, it has embedded this into our electronic medical record, and we named our community site Resourceful. So that is our white label on the National Find Help platform. But I also want to call out that Sanford also has a white label, and they have also embedded this into their electronic medical record, as well as many other health systems around the state of Minnesota and also in other states as well. So sometimes that just confuses folks when they say, do I go to Find Help or Resourceful or Sanford Connects, or where do I go? Anywhere is fine. Our collective goal is that people get connected to the services that they need. So I just always like to start with that piece. The other thing that I get this question a lot, and I know Angie talked about First Link a few times there in her overview, but folks say, well, why would we even go here and not just have people call 211? And I think if somebody wants to talk on the phone, 211 is the way to go. And we recognize a website is not the be all end all for connecting people to services, right? But what you can do with Resourceful or Find Help is that organizations, number one, like CAP-LP, have the ability to claim their program on the platform. And if anything changes, their hours, they add a location like Hawley, their eligibility rules change because something changed with the government rules. Maybe they're temporarily closed or out of funding, like last fall when SNAP benefits shut down. Great Plains Food Bank was able to quickly adjust their program to being available or not available. So the ability for organizations to control that is super valuable within this platform. The second piece is that you're able to make electronic referrals and track the outcomes. So instead of telling someone in need, hey, call First Link or 211 and good luck, and we don't get to know what happens, with this platform, anytime there's an update on that referral, so if I send a referral to CapLP from Essentia, um, anytime Angie and her team update that status to waiting for client callback, they're eligible or not eligible, they got help or we referred them elsewhere, whatever that status update looks like, I get a notification back via email saying your person that you referred, now has this status update. So I get to follow along on that journey of if they're getting help or not. So just a couple key differences there. Okay, now I'm going to go back to the actual website. And the first thing I'm going to call out, and I'll put this in the chat, but the homepage for Resourceful for anybody to access is weareresourceful.org. So I'll put this in the chat, but you can also, as Angie mentioned, go directly to Find Help, the umbrella. One thing I'll call out on our Resourceful page is that you start right here next to, some of you might recognize Taylor here, formerly at Great Plains, which it says behind her, but now at United Way. You type in your zip code here and hit search. So 56560, search away. But one thing that you might find helpful on our We Are Resourceful homepage is this trainings and tools tab. So if folks aren't able to be here today, there's a recording here of how to use the tool, as well as a helper navigator training specific to navigators using this tool, like saving favorite folders and keeping notes for programs and things like that. And then I'll demo this today, but in case you forget, you can always come back to this quick tip toolbox. There's little 3-minute videos of how do I claim my program? How do I edit my program details? How do I manage my inbound referrals? How do I use the free analytics embedded into the Find Help platform to write grants or do grant reporting? How do I manage my team? So lots of great tips just on the Resourceful homepage I wanted to call out. Okay, so once you put your zip code in, like I said, I'm going to do 56560, but I also just want to call out a new feature on the homepage here, which is eCheck. We just integrated this into Resourceful. It is a program that scans for 10 core federal and state income-based programs in 90 seconds and lets you know what you or the person you're helping might qualify for, whether that's health insurance, SNAP benefits, assistance with utilities, assistance with internet and phone bills, a bunch of federal and state income-based programs. So if you might qualify for those, it'll let you know within 90 seconds, and then it also gives you the link to apply to those programs. So really nice, efficient way to not, go to 10 different websites and look up information and apply. And then I'll just mention here, we do say, if you want to speak to somebody on the phone, please call 211. If you're in crisis, please call 988, or if it's an emergency, call 911. Again, we recognize a website for someone in crisis is not necessarily going to be the best place to go. Okay, so on to the quick demo of how to use the tool, and then I'll show you CapLP specifically, their listings, and how you can place a referral to them. So first thing I always like to mention is this drop down here. This entire platform can be translated into, I think, 60 plus languages. So in the Fargo-Moorhead area, I know our community health worker team at Essentia has found this valuable in, translating to Somali or Arabic or, a number of different languages. So the entire platform can be translated. Then on to searching. You can use the keyword search or program name search bar at the top. So if I know right away I'm coming in to look for CapLP, I can type in CapLP here. Oops. and just click on their program link. However, if I'm not sure what I'm looking for, I don't know that, I could type in food pantry. I could type in mental health counseling. I could type in that kind of thing as well. Otherwise, I can use these icons to find some of those. So, under food, there's emergency food, food delivery, food pantry, help paying for food. Same for housing, goods, transit, health. And then you'll see even under the subcategories, I go under mental health care, then I can find, you know, um, family counseling, individual counseling, substance abuse counseling. You can get very specific about the type of service that you're looking for. So I'll just pick one of these broad categories and then show you within those categories how you can even drill down to find the right program for the person that you're serving here. There are 3 filter boxes across the top that you can use to do that drill down I just mentioned. So under personal filters, you're going to see all kinds of demographics and different scenarios. So if you want to find a program that serves teens or young adults or seniors, you can choose that. Programs for active duty or veterans, you can find that. Immigrants and refugees, the LGBTQIA plus community, the somebody who's homeless or near homeless, somebody who is retired or unemployed. You can use the race and ethnicity filters. You can use education or disability filters. So there's all kinds of ways to find programs that might serve the person that you're working with. And I say that because oftentimes people that are in the social service field or in the navigator sort of helper role think, I know the programs around me. I know who to call in this scenario. I probably wouldn't need this, but I can share an example from one of our community health workers who's been in this field for a long, long time. And he was working with a patient in a very rural area who was diagnosed with cancer and needed ongoing infusions at Essentia. And so they needed transportation to and from home, which was about an hour and a half away. And the person didn't have a vehicle and didn't have any family who could drive him to these appointments regularly. So he discovered in the conversation with the patient that he was a veteran and used this veterans filter, selected it, and then found a federal level program that had volunteer drivers all across the country who would bring veterans to their medical appointments. So they were able to set up free transportation for this person, for all of their series of treatments at Essentia, which was incredibly valuable. So sometimes we think we know what all those resources are, but sometimes just by searching in here, you might find something that surprises you. The second filter across the top you can use is program filters. So if you want to find a program that's, open late or on the weekends, or that allows you to schedule an appointment online, or that has translative services in different languages, you can use the program filters. And then the last one is income eligibility, if you want to put in family income to see what they might qualify for in the programs as well. Then last but not least, up here, it's going to show you the most relevant services based on what you searched for. But sometimes if it's a program or you have a person who lives in a very rural area that you're trying to help, they might not have a lot of local programs. So you might see a lot of state or federal level programs pop up first. But if you want to try to find something like really filter down to closest, you can certainly click that button. And that's also helpful if you're looking for maybe a food pantry that's walkable or, a food resource. So just know that relevance and closest is able to be toggled between as well. Okay, so now I'm just going to jump into looking at program cards. So I have CAPLP's programs here. So I searched CAPLP, selected their programs, and brought up just their page. So they have 8 programs here. And you can see them all listed. So early learning scholarships, housing assistance, financial freedom workshops, the FRC, Career Connect, Workforce Development, Head Start, etc. So if we look at just the FRC program, I'm going to do just kind of anatomy of a program card. So when you're looking for programs other than the FRC, you know what this means. So CAP-LP is the organization, and then the program name is here. Now, I know that Angie or someone at her organization has claimed this program because this check mark is here. And that means that somebody from the organization is hopefully keeping this accurate and up to date. However, if they haven't, the Find Help data team promises to look at every single listing on this platform once every 6 months to verify its accuracy. So you can see that reviewed on date. So at least they're comparing with the organization's website or reaching out to them to verify, their hours, their location, everything is accurate. Then you'll see a brief description, ... and I'll show you where you get more of that. Then you'll see the main service tags. So that's how they show up in those categories and icons at the top, including other services, and then who they serve. So if I did those personal filters, I'm looking for programs that serve children or families or caregivers. That's how they would also filter and show up. Over here, you'll see what are the next steps. Here's the program's website. Here's where they're located and how far away from your zip code they are, the actual address, and then their hours. And then if I click on more info, it's the dropdown. So here's where I'll see a longer description of the program. But most importantly, right at the top is eligibility. So when Angie was going through her PowerPoint slides and talking about who's eligible to use the FRC, that's where you can find this information. Oh, the family I'm serving actually lives in Cass County, not Clay, so maybe wouldn't apply, or they don't have kids in the home, or, so you can determine right away, I don't want to bounce around the person that I'm serving to a program that they're not eligible for. So using this information is really valuable. And then, is the program available? Is it on a wait list? Is it temporarily closed? Are they out of funding? And that's where I mentioned for organizations to claim their listing, you can easily update this in real time and make people aware of if anything has changed for your organization. Okay, last but not least, it's going to let you know if they have interpretive services available, more ways to contact them. Again, the coverage area, which I know is really helpful for our care team members at Essentia in case they're working with a patient that might be moving. Okay, is this program available if they move across the river to Fargo? What does that look like? And then last but not least, their location. So if they have multiple locations, you'll see Hawley there now listed as well as Moorhead. So, and then their hours at that location as well. So that's just kind of an overview of the program card. And if you're somebody who likes to print and hand something to the person you're working with, you can print this as a PDF, and it will give the person you're working with all the information that you're seeing right here online. However, it is 2026, so you can also share this program information electronically with the person that you're serving. So you can send this information via email, via text message, or even on Facebook. And I just want to clarify that, in a professional role, of course, especially here within healthcare, we're not going to send a private message to somebody on Facebook from our own personal Facebook page. So I just like to call out, when you click these options, it's not coming from your personal email, your phone number as a text message, or your personal Facebook account. It's saying someone at Resourceful, Jill D, sent you this information. So it's coming from an anonymized account. So know that you can print it, but you can also just send information on the FRC to the person you're serving via email, text, or Facebook. Now, a couple other things I'll just share here that are nice benefits for folks that are in that helper navigator role, whether you're a social worker, financial navigator, working within the schools, you're a community health worker, etc. It's really nice to be able to save these programs to a favorite folder for quick access next time. So you don't have to go in, type in CAP-LP, scroll down, find the FRC. You can go right to your favorite folder and find it there. And you can do the same thing. I know our community health workers have favorite folders for food and housing and transportation and mental health resources and sometimes by community. So you can build favorite folders for that quick access. So for example, if I wanted to save this to a folder for CAP-LP or for Family Resource Center and maybe a couple of them, I could save them into a favorite folder. However, I can also add it to a favorite folder if I've already built one. So you can just pick a folder and add it to it. What's one step further that's really nice is this notes tab. So if I know that at the FRC, Angie is the, intake coordinator, and in on Tuesdays and Thursdays, and her direct phone number is, I can save that note so I don't have to try to remember it or write it down on a sticky note or whatever. I can save that note and I can gatekeep that information and save it just for myself. Or I could share it with my whole team. So if I wanted to save this note and share it with my community health worker team at Essentia, I could do that. And you can create a group in Resourceful for your team as well. And this is a huge value add for an organization that might have a lot of turnover in these social service helper navigator roles. So that if somebody new comes on board, they don't have to figure out which organizations do this and who do I contact at that organization? What does that look like? This is incredibly valuable to stay with your organization. Additionally, if you have somebody who's been with the organization for a long time and they leave, that wealth of knowledge and relationships doesn't leave with them. So you can keep all this information here and help each other out. So the last button I'll share here is just suggest. So we all do better when we all do better. If you know that the FRC has a new location in Hawley, you can type in here, hey, they have another location now, and then hit suggest, and the Find Help data team would reach out to them and say, hey, do you have a second location? Let's get it added. Or their hours changed, or this business closed, or you can help make sure that this platform stays accurate and up to date. Okay, then most importantly, how do you connect with them? So for the FRC, it says apply here, which looks a little bit different than their financial freedom workshops, which says refer. So when it says refer, it's a one-click referral. I type in who I'm referring, I get their consent to share their contact information with CAP-LP in this program, and hit send. So it's a one-step referral. However, the FRC says apply here because they need some additional information to determine eligibility. So they do say that right here. But if I type in, and the nice thing about this too is if it's somebody that I've worked with before, their information will stay and auto-populates. Take me a bit of time. Emily wants a phone call. There is an opportunity to add a note, like maybe Emily works overnight, so call afternoon. Or I'm Jill, I'm her community health worker. We meet regularly. If you have any follow-up questions, here's my direct line. What you wouldn't want to ever put in the comment section is anything that you would consider PHI. So they have this diagnosis or, things like that. Then last but not least, confirm consent. And Angie, you're going to see this referral come through. I apologize, but this is a great way for us to just show everybody what the screening form then looks like. So next step is that apply. So I am going to fill out a couple of additional pieces of information that they need. So you'll see, do I currently live in Clay County? Do I have someone under? So they're just verifying that information. That's part of that eligibility. And then it asks me for services requested. But one thing I'll call out is you'll see this red star here, which means I cannot send a referral for somebody if I don't answer those questions. But if I don't know exactly what services they need, and this person is maybe leading the ED, but I think they'd be a great fit for this program, and I don't, know exactly what they need. I don't have to fill out that section, so that's also nice. But if I do know, and I'm having a conversation with them, and I know that they need, help with household expenses or parenting classes and transportation, I can choose those. And then it also asks for the referral partners. Then you just hit review and submit and send off that referral. So for any other organization, you can do the same thing. If you require some additional information, you can add it in by building that screener to ask a couple of additional questions that come along with that referral. Okay, let's see. Did save to favorite, search and refer. Okay. Now, if you are somebody who wants to get your program listed or see if your program is listed on Resourceful, you can go down to the bottom of the page here and click on Suggest a Program. You'll see there's also that Claim a Program button. Either one works. It's going to see if your program's listed already first. So you type in, CAP LP, Family Resource Center, you serve Minnesota. If you have a phone number, website, great, but you don't need it. You're not a robot. And then you click search and it's going to say, oh, here's your program. Is this it? Does it already exist? If yes, you click on it and then you can claim it, saying you now have access to edit the program details. If it's not listed, then it's just going to say, tell us a little bit more about your program, suggest it. You'll get an email to verify you work for that organization. And then you can go ahead and start building your program. I won't go into details on that, but once you claim a program, you will have, ways to edit your program details, how to turn on referrals, how to manage referrals, how to use your analytics, add team members so they have access to edit your program or see referrals. Lots of good information I'm happy to share with any organization or team that would like a follow-up, but I won't do that here today. I will just show though that CAP-LP right now, when you send a referral to their Family Resource Center program, they get it two ways. So the first way they get it, and I apologize, this is a little bit small, but they'll get an email that says, Resourceful, they sent a referral for Emily A, as I just showed earlier. Here's her contact information, please reach out. Because of PHI and HIPAA compliance, it's not going to say Jill Doberstein at Essentia Health referred Emily Anderson with this, so it's not going to spell that all out, which is where when I showed the notes, if you want to include your contact information or more details, you certainly can, but otherwise it's going to keep it very basic. And then it's going to give you these 6 clickable links. We got in touch and we'll try to help. We can't provide that service, so we referred them elsewhere. Sorry, they're not eligible for our program. We couldn't contact them, or we don't have capacity. So you can close the loop on that referral right from the body of the email. But we also recognize it takes some time to get in touch with folks. Sometimes you have to make 2 or 3 phone call attempts, and then you have to determine eligibility, maybe fill out some paperwork, and then you provide the services. So that might take some time, in which case you can then use your inbound referral dashboard, where you will also see everybody who's been referred to your program show up here. Now, in this example, I only have 1 open referral, but I can also see all of the closed referrals, so that have a status update on them. So again, here's Emily A, who referred them. If there was a screener, so for the Family Resource Center, we know they have that screener so they can view it, print it as a PDF, and then I can update the status. So I may be waiting for the client to call me back, or they are eligible, but we haven't yet provided services, or they got help, or they're no longer interested. So I can update the status as often as I would like. And again, when I do that, it sends a message back to the person who referred them to let them know where things are at in the process. Okay. I want to reiterate that this platform, Find Help, Resourceful, Sanford Connects, together, the mission of this platform is to provide free and reduced cost services, connect people with free and reduced cost services. So we often get asked about, well, what about childcare or long-term care or acupuncture, massage therapy. Unless those organizations offer a sliding fee scale, reduced cost services, scholarships, things like that, they unfortunately would get denied to the platform. Now, there's a caveat to that, and the caveat for us at Essentia Health and Resourceful is that we have decided to whitelist anyway all behavioral health programs. So one of the differences you'll see on Resourceful versus Find Help or maybe Sanford Connects is that you'll see a whole lot of mental health and substance abuse programs that generally Find Help would decline the listing because they might not be determined free or reduced cost. But we recognize it's a huge need. It's a gap in our service area, and many of them accept Medicaid. So we have decided to just list those anyway. So that is the only difference when we talk about that no wrong door that you might find on Resourceful versus Find Help or Sanford. Okay. That's the last thing I'm going to share, except for I'll go back to our weareresourceful.org page and show you that at the top here, there's a place to sign up to receive updates on Resourceful. One of the things that we do, and I saw Ashara is on the call here, but we have these community-based organization spotlight webinars every quarter where we feature different referral partners like CapLP. It's a 45-minute webinar where they can share, here's who we are, here's who we serve, here's who's eligible, here's how you can refer to us, here's the specific services we provide. So a lot of what Angie shared in the beginning. So last month, we actually featured Ashara, the YWCA of Duluth, and Justice North around their New Neighbors program, their mutual aid fund, their immigration attorney work. And we will have all of those listed here so you can watch previous webinars, but you can also sign up for future webinars here. Additionally, we also have an e-newsletter that we send out that shows here's new programs and resources that you can refer to on the platform. Here's some new tools like that eligibility check I shared at the beginning. So if you're interested and want more information on any of that, you can click on that from the weareresourceful.org trainings and tools tab. But I'll put that in the chat as well. And with that, I'm going to stop sharing unless Angie, there's anything else you would like me to share or show folks regarding FRC and how to refer.
No, I think that's perfect, Jill. Thank you so much. That's very in-depth. And then we'll just wrap up. I know if you can stick with us a few more minutes, those who are on, we'll wrap up with a little bit more information. And then if you all have things you want to share, we may have some time at the end. I am going to pull up our slides again here. So Jill had already talked about how this referral process works. I just had a little bit of information on that one. And then just to talk about what we would do on our end. So once we do receive those referrals, we have a small team here. So we would reach out within 2 to 3 days to the person who referred. That's where we're starting at these partner referrals. And so then we talk with you as far as what does this family need and how could we further support the family, and then make a plan of how we can work together in that way. The other thing I want to highlight is that, of course, families can connect with us directly too, in all those same traditional ways that they have already been connecting with us, but they can also refer themselves through Resourceful. So any of those are just fine. The main hub for us has been our website. So families, we're kind of pushing them to our website. They can go there. Every page of our website has a button on it where you could click and get connected to the Resourceful application. And then also they can email us as they always could. They can come to our drop-in office hours. Our Hawley location is staffed where you can call them because they're open kind of 8 to 5 every day. They're more of a traditional building. So that's just a little bit about what we would do on our end. And then I'm going to turn it over to Steph to give that update about what we do out at the Hawley location.
Yeah, thanks, Angie. My name is Steph Sink, and I am the manager here at CapLP Reach in Hawley. So Reach was a nonprofit organization, been a nonprofit organization in the Hawley community for the past 30 years. And in January 2026, this past year, REACH became a program of CAP-LP, and REACH stands for Rural Enrichment and Counseling Headquarters. Also then, starting July 1st, CAP-LP and REACH in Hawley, we became a site to provide the family resource centers to clients living out here in rural Clay County. And so our office is in Hawley at our address is on there, 421 5th Street, phone number. And like Angie said, we're open kind of traditional office hours, Monday through Friday, 8 a.m. to 4:30 p.m. You can go to the next slide, Angie. Thanks. So some of the services and programs that we offer at CAP-LP REACH in Hawley, we have a food pantry, which is open Mondays and Thursdays, 9 a.m. to 4 p.m. People can stop in and use the food pantry during that time. They can call over the phone. We also have where people can order their food online. And I believe if you go to the CAP-LP website and you look for REACH, that would bring you to where you can go and order online. There's a link to order online, and I could email that out to anybody that would like that link. We also provide counseling services here at the Hawley office. We have Solera and the Village come and provide counseling services. They're each year at least once a week, and to get a referral for those counseling services, you would just have to call our office, and then we make the referral to Solera or the Village. We also do a school supply and backpack distribution, which right now we're doing for kids that are in need of school supplies. They can come to our office and pick those up. We do a winter clothing distribution, which is kind of ran through our thrift store, because we also have a thrift store out here. And then we do a holiday food basket and gift program in November and December. You can go to the next slide, Angie. So we're really excited to kind of be a family resource center site, since they don't really have enough like an actual physical site. It's nice that we can have one here in Clay County, and we're hoping to get the word out that this is where people can go to receive not only the programs that we have offered for many years, but also now the Family Resource Center services. So we can offer those concrete supports for families if they are in need of help getting like a gas card to get some gas in their car to get to an appointment or something up in Fargo-Moorhead. They can come to REACH during our office hours. And then we can also meet them if they don't feel comfortable coming to our office at the family's preferred location. We also help out with filling forms and applications, and then just finding, if it's something that we're not able to help them with, finding another resource for that family. So about the referral process, so you can use the QR code that is on this slide that was at the beginning, or to findhelp.org, or we are resourceful. Or you can just directly contact our office at the phone number, or send me an email at staffs@caplp.org. And then also just sending people to our office during our normal office hours. Walk-ins are welcome here at the CAP-LP REACH office in Hawley.
Thank you, Steph, and thanks everybody for sticking with us a little bit. We have one more very important component, so Kaylin is going to take over and talk some about the Family Advisory Board. And if you're ready, Kaylin,
there we go.
Ahead.
So hopefully, I think everyone can see my screen. I am the Family Advisory Board Coordinator for our FRC. So I'm just going to jump in real quickly here. What our Family Advisory Board does, they serve as they're meant to identify the gaps and the partners, inform and improve the systems and processes, help us really to identify what we need in our community and what we can improve on. They are the piece that helps us to be family-led in all of the efforts that we're making and what we do. We do have 4 spots that we could fill. We can comfortably operate with 7, but we have up to 9 spots on our board that we can fill. So we would love to, we know that the power of that direct ask is really powerful. So if you know of someone who has experience in caregiving in Clay County and navigating some of those systems, think of the people that you could maybe say, you'd be great at this, you belong here. We know that that really goes a long way. Right now, we really have identified a need for rural representation, some dads, LGBTQIA2S community, and then BIPOC, also kinship navigators. We are a family advisory board, so people don't have to be bio parents to be welcome at our table. People do have to live in Clay County, and they need to have had lived experience navigating systems in Clay County with children as a direct caregiver, not someone being paid to take care of children, but more in that family sense. Then what they're signing up for is a 2-hour meeting per month where they share their experiences, their perspectives, help us identify gaps and needs in our community, partners to bring to the table. Partners can also lean on them as a ready-made focus group if they need that support. Our family advisory board members are reimbursed for their time. For childcare needs, if they need to pay for childcare, they can get reimbursement for that, and supported in other areas where if they're facing barriers to attending, we can help with that. We do offer a hybrid option for our meeting, so people can join virtually or in person. And most importantly is we have really clearly defined roles. So outside of that 2-hour meeting a month, they have opportunities for other events or volunteer options, but they're not expected to do anything but share that really valuable advice and perspectives that they bring to the table. So we need your help with recruiting and directly asking and recommending people to apply to our board. And there is a QR code there that you can scan to get them directly to that form. Otherwise, always welcome to reach out to me directly. If people need support, maybe don't have tech access, we can help with a paper copy or whatever else is needed there. And then if anyone has questions, I am here to answer them too.
I know we're kind of wrapping up.